Yeah, so pulmonologists play a very important role in diagnosing lung cancer, and then we are also involved in part of the treatment for lung cancer as well. The diagnosis part, usually we have these screening methods that we use to diagnose lung cancer. So this starts with doing a yearly CAT scans in patients who are high risk for lung cancer. The diagnosis of lung cancer usually starts off with lung cancer screening with a CT scan. Once we have identified that you have a high risk nodule on your lungs, then we go ahead with the diagnosis part. The diagnosis usually involves a biopsy. Biopsy can be done in many different ways. Here at Ellis, we do one of the newest and very accurate form of biopsy called robotic bronchoscopy. And with this technology, we are able to detect cancer at a very early stage, and then when really small nodules can now be detected with this technology. Anybody who has smoked significantly pretty much their entire life should get screened. Screening usually starts at 50 years of age, and we screen people up to the age of 80. And we should also remember that your risk of cancer, for particularly lung cancer, stays high up to 20 years after you quit smoking. The symptoms of lung cancer are usually become apparent at a later stage of cancer. Lung cancer can take a long time to get to a stage where people become symptomatic. So that's why we focus so much on lung cancer screening these days. But some of the symptoms would be chest pain, worsening shortness of breath, coughing up blood, and some other symptoms. So the most effective method that's available and that's widely done these days for lung cancer screening is a low-dose CT scan. And it's done once a year for high-risk patients. And it is pretty accurate and helps detect cancer at a very early stage. Screening is very important for early detection. It makes the difference between a cancer being curable versus not curable cancer. So if we can detect cancer at a very, very early stage, when it's a mere nodule or a spot on your lung, the chances of getting patient cancer free are higher. So for preventing lung cancer, the most effective strategy on the part of the patient is not smoking or to stop smoking. And from a provider perspective, the most effective strategy is to do a CT scan of the lungs starting at the age of 50 up to the age of 80 in high-risk patients. This way you can detect lung cancer at a very early stage when it's a small nodule, which is a small spot on your lungs. So the focus should be on the early diagnosis of the lung cancer. The reason being that lung cancer is one of the cancers that becomes symptomatic at a very late stage. And it can be a very long time until patients develop symptoms, and at that point, a lot of times it's not curable and sometimes even not treatable. So the focus, I think, should be on early detection.